I think we're joining on Facebook Live as well. Okay, we're going to start now. Good evening, everyone. I appreciate everybody hopping on again. This is our third installment of Take 5 with Frank. In this third installment, we're going to be speaking with Dr. John Pellitteri. John, I appreciate your time. Thank you for hopping on. We're going to talk, obviously, with this crisis and everything that's going on from both a health and an economic standpoint. We thought it made sense to have John join us and talk about the crisis from a slightly different perspective. And I'll give you some of John's background, and we can start to roll into this. Dr. Pellitteri is a licensed psychologist in New York State with over 30 years of experience in both clinical and educational settings. John has a Ph.D. and is an associate professor with Queens College in New York, where he trains graduate students in both school and mental health counseling. John is also the president and co-founder of the International Society for Emotional Intelligence, a nonprofit organization that promotes the global advancement and development of emotional intelligence theory. Dr. Pellitteri has published several research studies that focus on the emotional intelligence and has authored several books on the topic. Before I hand this over to Dr. Pellitteri to speak on the current crisis, I wanted to speak about something very important. The current economic and health situation that we find ourselves in this country has also awakened another silent killer, mental health. 1 in 6 adults in the U.S. experience some form of mental illness each year, with suicides being the second leading cause of death in Americans aged 10 to 34. Dr. Pellitteri, we spoke about this earlier, but can you speak on the call on how the listeners should be dealing with this isolation, depression during the crisis itself? And thank you so much for joining us today, Dr. Pellitteri.
Thank you, Frank, for having me. I appreciate the opportunity. It's important to give this opportunity for the public to hear about different perspectives and certainly to address mental health, which is a very important topic. As I was saying earlier, a lot of problems existed economically, in education, in mental health and medical health. A lot of problems existed before the COVID crisis. And now with the crisis, it amplifies and exacerbates existing problems and creates new problems of its own. So these are unprecedented times, and we've never had quite a situation like this ever before. How do people deal with this? Well, it's a lot to deal with. People are dealing with excessive stress, anxieties and fears. People are dealing with depression. Any existing mental illnesses are always exacerbated by stress. So there are a lot of mental health issues coming out, and it's difficult. It's very, very difficult for people, especially because now they're afraid to go out. People don't want to go to the hospitals for psychiatric care because they're afraid they might catch the COVID-19 virus. So that's another problem. I know in my private practice, I have clients who I've worked with to try to get them out. They're already lonely and by themselves and isolate from people in general. That's part of their psychological issues. So I'm trying to get them to go out and interact with people was a clinical goal, and now everyone's got to be shut in. So it just amplifies that loneliness even more. And it's taken a real toll on a lot of different people across the whole spectrum of society. I was talking to a colleague of mine. Yes, go ahead.
Sorry, John.
No, I said I was talking to a colleague of mine, and he's seen an increase in suicidal ideation in some of his clients. And that's a big problem. That, people need to get help. They need to speak out. It's a very serious thing, as serious as the virus itself. People have to speak out. They cannot be afraid. They have to reach out for help. Many therapists that I know now are working online or through the phone so they can provide treatment. Treatment is available. There are actually volunteer programs where people can reach out. First responders and essential workers who are going through stress have opportunities to reach out. There's a COVID care network in New York City. And I can send you the link for that, where anyone who's an essential worker who's going through the stress, or their families going through the stress of that, have an opportunity to get some free short-term counseling through that and support. Okay. And so there are resources out there. People need to know that they have to reach out.
Okay. Hey, the one thing I wanted to bring up, and I didn't mention it before, I was working downtown during the September 11th attacks, and there were some similarities to this. Obviously, people were not expecting it. We did see an increase in suicides as well after this was over. How is this crisis different? Obviously, it wasn't a terrorist attack per se, although some will say it was. How is this different than a traditional attack on our country?
Well, it's a different domain altogether. I mean, dealing with terrorists, dealing with people who are politically driven, that's one type of war. This is a war against a virus. It's at a microbe level, and it's invisible. And that's what makes it scary and dangerous. So it's a totally different kind of war. And obviously the strategy and the response is different. I mean, the US military has done so much for the country, and they have come in to help out. They were in New York the last few months, and they still continue to help out, but they're not helping in a typical military way. They're helping with patients who are sick and moving people. So, the response on the government has been the best it could be, but it's very, very difficult. It's a very unusual situation. And I think what makes it harder for people psychologically to adapt and to adjust. And what do we do? How do we deal with this? We've never had a situation where we have to stay at home and not go out.
Yeah, it's kind of, again, we were back in Manhattan after the September 11th attacks. Anywhere from 1 to 5 or so weeks afterwards is when we finally got up and running. We're on month 3 of this, and right. Even though you're starting to see some things open up at this point, it almost feels like there's going to be a pretty serious lifetime change, lifelong changes we're going to have to be making after September 11th. The biggest longer term changes we saw is what we continue to see at airports today with security. But looking now, apparently there's, I don't know what the thought's going to be about masks. I don't know what the thoughts are going to be about how you have to make reservations and be in restaurants and how retail is going to begin to operate. So, it feels like this is something that's going to be with us for a very, very long time. And, irrespective of whether we get our hands on a virus sometimes, a vaccine sometime soon, just feels like this is more of a change to us as a society than the post-September 11th attacks.
I agree, because the US has been in military wars before, and in September 11th, there was a clear enemy. You could see the enemy. You knew who and what they were. This is a very different kind of war, and that's what makes it so challenging. And yes, it's created a very significant shift in society, with schools, with businesses, everyone going online and working remotely in whatever way they can. That's shifting society. And I think even after we get a vaccination and things go back to normal, I don't know if it'll be exactly what the normal was.
Right. Understood.
And any kind of large scale change is difficult for people to grasp. It's difficult because you have to create a new way of thinking. You have to have new concepts, new schemas, new frameworks for thinking around things. And that's what makes it very challenging and difficult.
Right.
So as a society, I think we have to adapt in developing this new way of thinking.
Yeah, unfortunately for everyone. Hey, we got a number of questions that came in. We came in before, and we've got a few coming in fast and furious. But I'll just try and pop through a few of these.
Okay.
Betty from Ramsey asked a question, and I think you addressed it, but maybe more specifically, how has COVID-19 impacted personally your work as a psychologist?
Okay. Yes, well, I'm working online now through Zoom or through phone sessions with my clients, and it's very different. It's not the same quality of care. It's not the same as being in a therapy room with a client when you're sitting a few feet away from each other. So that's shifted how services are delivered, and that makes it a little more challenging.
Right.
Yeah.
Another question from George in Connecticut. What are the I don't know why Connecticut came through for a District 5 race, but what are the conversations among medical professionals outside? We have a tremendous reach, Dr. Pellitteri. I hope you understand that.
I see that, yes. The whole tri-state area.
Exactly. We've got one coming in from Bangladesh soon I'm going to look at. What are the conversations among medical professionals outside the infectious disease about how to assist in response to COVID-19?
say about how the medical profession is outside the infectious disease
Right,
special.
we know, and obviously that's something that you're in the middle of. We had someone talk earlier about, and they're in the middle of it. You're obviously the second derivative of the after effects of this going on. What conversations are going on among folks in your field?
Well, again, I think people are helping every way they can. Obviously, this is a crisis. It's a terrible thing, but in some ways, it's bringing out the best in people. So I think everyone is helping out in every way they can. So as a psychologist, and as part of the International Society for Emotional Intelligence, my colleagues and I have set up some webinars for using emotional intelligence to deal with the COVID crisis. And we've had people who have been positive and have survived, people whose businesses have been affected, people who are dealing with shelter in place. So that's one way that some of the psychologists and counselors are dealing with this. I think everyone's doing what they can in any way they can.
Yeah, this is something I know a lot of educators are out there, and there are students that are out there as well. This one came in just the other day. You work with college students every day. What lasting effects will this crisis have on our youth, both in college and those that are coming into college who are going to be obviously coming in on the heels of this? I know you work with them every day, so your response is important.
No, I teach college students. It is, again, similar to the therapy, is a different feeling, a different effect when it's done online. The same thing with teaching. I teach my courses online and the students are there, but it doesn't feel the same. It's not, I don't know if they're learning as much. I certainly have had to cut back on certain things that I wouldn't be able to teach because we're not in the classroom. I know my own daughter was away at college and had to come back when they closed the dormitories, and that's had an effect on her learning as well. It's not the same quality. It is an impact. Now, if it's short term, half a semester, okay, I don't think that's terrible. People can recover from that. If it's another year of online learning, that'll be more significant. So I certainly hope we get back into the classroom in September. I would like to personally, as a professor.
Yeah, it sort of feels like it. We're sort of at ground zero here in the New York metropolitan area, and we deal with a lot of folks around. We have campaign has regular calls with other congressional candidates around the country, and it goes from where we are now, where you see masks and gloves all the time and people are talking about it, and other areas like Texas and North Carolina and Florida, where they understand the severity of it, but you're not seeing a lot of people, I wouldn't say practicing it, because they've got much lower incidence of infection and mortality rates are much lower as well. And so it almost feels like there are going to be some changes. It's unfortunate, and I think this, Dr. Pellitteri, but more than half of the deaths in our area, it's particularly in New Jersey, 52% of the deaths were in elder care facilities, and some of our veteran facilities. And I think as we sort of go through and we peel back the onion and look at the numbers in the general public, again, we're starting to see the governor open things up, which I think is a plus, that at least we're looking at getting our lives back to normal. But I think a lot of people on this Zoom call are wondering what the next 3 or 6 or 9 months are going to look like in terms of as we recover from this. I imagine I don't know the answer to this. Your business is going to get busy over the course of the next year or so, I would imagine.
With the mental health services, sure, it may be. People are resilient, though, and there's a saying I say to my graduate students, and the Chinese symbol for crisis is a combination of two different symbols, and the two different symbols are danger and opportunity. So I don't know if it's an exact translation, but I think it's a nice thing. So this is a crisis, and there's definitely danger here. There's already been a lot of damage. There's a lot of risk. But alongside of danger in the same space is this idea of opportunity. So I think it's creating an opportunity for people to reach out and be closer to their neighbors. They have to be 6 feet apart, but 7 o'clock, everyone's out there having more of a community feeling. People are cheering the healthcare workers and nurses and doctors, the heroes on the front line. There's a much deeper appreciation for what they do and they're putting their lives out there. So there are good things that can come out of a crisis. And with that too, the changes in society going forward, hopefully we can incorporate some of these advantages, these good things that we're learning.
Right. It sounds like eventually, Dr. Pellitteri, we're going to get to a point where, you know, you're not going to see a lot of the masks and you're not going to see a lot of the gloves and we just got a question from John and Ramsey. When it comes to, you know, as you said, you're doing a lot of stuff online now. If this is a one-on-one consultation or a meeting, do you think that, you know, you could provide or there's the opportunity to just, if someone has a mask, that they can come in, or mask and gloves? I'm imagining your office is big enough where social distancing could be had while providing hands-on care. Is that something that you've thought of? I'm just curious if that.
Right. You know, I think even when they lift some of the restrictions, people are going to be very extra cautious, as it's understandably so. So I'm not sure exactly how that would work. My office might be big enough. I know some people have very small offices. They can't be 6 feet apart from their clients. And it's a smaller space without good ventilation. So, you know, you have several clients coming in during the day that could create a more hazardous environment. So I don't know. I mean, even with masks, I really don't know. It's going to be difficult.
Okay.
I think it's going to be unfolded in pieces, just a little at a time, which is probably a prudent way to go forward.
Right. Okay. Oh, let's see. Good gosh, lots of questions coming in. This one's a long one, so you might have to write some stuff down.
Oh, okay.
Just talking about the grassroots support that we've seen, and it's just like you said earlier, Dr. Pellitteri, that things like this, you find good in people, and people will find a way to work with each other and get out. We see everything from, you know, fire trucks that drive by and they do the not the virtual, but the drive-by celebrations. But someone had asked, do you see any longer-term effects or longer-term opportunities to set up these community groups in case something like this happens again, so that we're more prepared to kind of go through this? And is this something that you think, look, we know the government, both municipal and federal government, are going to do what they can to make sure not just this doesn't happen again, but if it does happen, that we're more prepared for it. Is there anything that you see that we can do to be better prepared in the background so that if something like this happens again, you know, we're able to move forward? Again, it's a little bit all over the place with the question, but it has to do with, is there something we need to do with EMT and paramedics? Is there something we need to do with our other first responders to make sure that we're giving them what they need if something like this happens again? Is there any thought that you have on that? And their questions are coming in, so I apologize that we didn't have this one earlier.
That's a huge, multifaceted question. So I'll speak to that question from a psychological point of view. Okay, since that's my specialty. I would say that helping people be better prepared to deal with stress as a general psychological rule is a good thing. You know, first responders, people on the front lines, you know, nurses, doctors dealing with people who are passing away. There's a lot of stress inherently involved in their jobs. And obviously the pandemic has multiplied those stressors. So training people on stress management and skills of emotional intelligence and coping skills, training people as a general rule could help them to be better prepared to deal with crisis, particularly long-term challenges. I certainly hope this never happens again. And I think we will be better prepared because we've learned from this experience. But I think, you know, that kind of across the board support for people's stress management is a very important set of preparation for life in general, not just for pandemics.
Okay. We have a question here, and it was a question for the doctor, but and I don't know if you can answer this. I don't know where you are in this, but from the trending we see, we know it's getting better. But are you able to speak to, and I don't know the answer to this, are you able to speak to some of the recent infection and mortality rates and where we're trending? And on top of that, we've talked about the potential for a second wave in the fall. Are you guys talking about that, or can you give any color as to what you see, any, you know, where the rates are now and where you see future rates?
I couldn't really speak to that. I'm not, you know, a medical doctor,
Okay.
so I don't think I could speak intelligently about the specifics or give any predictions around that.
Okay.
I just know that again, when people are going back outside more and they're lifting some restrictions, I think people will need to be cautious.
Yeah.
A certain degree of anxiety is actually not a bad thing. It keeps you sharper, it keeps you more attentive. So that's what I could say.
Yeah.
Going forward.
I think we might have had this or something related to this. There's been much discussed about the toll on mental wellness caused by this lockdown. Can you speak to that from your professional perspective? I
Sure.
think
Well,
people,
like I said earlier,
by and large, obviously isolation is a big deal. You know, from my standpoint, I kind of see, again, you know, it's a tremendous economic toll. It's a tremendous health toll.
yes,
And,
yes.
you know, if you're in the middle of it, everywhere you turn, you know, your life has changed. The economics of your situation has changed. If it's not housing and the ability to pay your mortgage, it's the ability, you know, to put food on your table. And I think some of those concerns are, you know, they're real. And I think there are a lot of people out there that just don't know how long it is. And we talked earlier, Dr. Pellitteri, the government is doing everything they can. They are completely overwhelmed with, you know, we saw the unemployment number today. Even with everyone doing everything they can, help is not getting to the people. And some of those people who are not getting help are part of the 1 in 6 that are suffering from mental health. So could you speak for a moment, you know, to the people on this call who may themselves be struggling with this, and others who may have friends and relatives that are struggling as well, what they can do for them who are struggling?
Sure. No, I mean, as I said, it's an unprecedented crisis. We've never had a situation where we need to choose between public health and the economy. They're both important, and every solution is still going to have its limitations and problems. How do we deal with this? Well, I think one way is that people have to try to be gentle with themselves and try to be aware of what they're feeling. A lot of the research in emotional intelligence shows that when you could manage your own emotions, you are not consumed by them, you're not debilitated by them. And a lot of mental illness issues like depression, anxiety, drug addiction, isolation, a lot of these problems are related to emotional factors. So when we can manage our emotions, it helps us to get through. It doesn't solve everything, it doesn't cure everything, but to be able to acknowledge, hey, I'm feeling really scared now, rather than suppressing that and trying to tough it out and disconnect from that feeling. Or things are looking really hopeless and difficult, and it's a really difficult place to be. And just accepting that. Doesn't mean you have to give up, but it's just saying accepting that this is what I'm feeling, and it's okay to feel that. We have all felt a range of emotions, some of them very intense and overwhelming. This is normal. This is understandable under these situations. So no one should feel bad about feeling bad or about having painful emotions. This is understandable. And you mentioned the idea of wellness and well-being. An element in well-being is to you just be able to accept, you know, who you are, where you're, what your situation is, and then go from there. Again, it's not a good solution. The outcome is still going to be difficult. The road is still going to be long and hard, but at least coming to terms with this is what I'm feeling, and it's okay to feel that. That's one thing I would say. One piece I would give.
Appreciate that.
I would add. Yeah, go ahead.
I was going to say in kind of closing, and I want to hear everything you have to say, but I also want to make sure that the people who are listening and they can tell others, is there a way right now that they can seek help, either for themselves or for somebody who else is struggling, you know, get on the phone and say, look, you need to call, you need to go here. I'll come with you. I'll do this with you. But if there's something we can do right now.
Well, like I said, there's the COVID Care Network, which is in the New York City area, the tri-state area here. You know, it depends what the local hospitals do. I know everyone's overwhelmed, but you have to try to find the right resources in your particular community that you could reach out and find therapists and counselors who could work with you. There are suicide hotlines. I'm sure if you don't have that, I could send those numbers to you. If anyone's feeling suicidal, there are trained people there to talk with you and to help you through it. Remember, when you're feeling really down and depressed, that is a certain state of mind that you're in.
Okay.
And when you get out of that state of mind, then suicide doesn't seem so rational. You know, but in that state of mind, people could be really affected, and understand it's a temporary state. You're not going to be in that state forever. So if people could remember that and reach out for help, very important, reach out for help. for a professional, but also from others, family members, friends, community members, coworkers. Reach out. You're not alone. And that's a very important message. So they call it social distancing, but it's really physical distancing. It doesn't have to mean social isolation. And I know internet and Zoom and phone calls are not the same, but they are the tools we have to reach out. Reach out, connect to people. And even if you're not depressed or suicidal, but you're just feeling lonely or you're feeling down, reach out to people. Connection is part of our human nature. And it's a very effective way to adapt and to help each other. And you feel good by helping someone else. They could feel good by receiving your help. So I think it's important to reach out. And another point I would make is that maybe we could try to be proactive. I mean, we all know people in our lives. Reach out to people who aren't reaching out to you yet. Maybe an elderly person who might be lonely, or someone who lives by themselves, or someone who might have had a history of mental issues. Reach out and check in on people, touch base with them. Just want to say hi, shoot you an email or something, just want to connect. So I think as a community, if we all look out for each other, that's a good preventive method for the larger society here. We all have resources to help each other.
Yeah, that's great advice, because I know people here are pretty concerned with their own mental well-being and those of their friends and family who are close with. But I think you're right. People who you may not have been in touch with for a year or so, if you know that they've struggled in the past, I think that's a great idea. Pick up the phone, send them an email, do something to connect with people. And I think that's important to know. Well, great. Dr. Pellitteri, I appreciate your time so much. And I know the other folks, I appreciate everybody for hopping on here. This is our third installment. We've gotten some really great feedback. Dr. Pellitteri, this was terrific. I wanted to do something a little different. And just so everyone here knows, I picked up the phone and I reached out to Dr. Pellitteri. He couldn't have been more gracious with his time and the opportunity to help everyone. So, Dr. Pellitteri, I do appreciate everything you've done. And if anyone has any questions, your information is on the website. Some of your publications are on the website. If you need to reach out to Dr. Pellitteri for anything, feel free. But thank you so much for your time. I appreciate it.
Thank you for having me, Frank, and thank you for
everyone.
having the series for the community. It's a really important thing that you're doing. Thank you.
Thank you. Be well. Thanks, guys.